with this virus right now, and what it's doing and what's happening and how people are feeling. What are you hearing from your clients?
I think it's posing a lot of opportunity, really, for my
Mm-hmm.
clients. Um, in fact, I had a session earlier today, which I said to the client, what would you prefer to have? A problem or a project?
Oh.
And their face got really lit, and it was like, of course I would prefer a project. And that's what that's the opportunity we're given right now,
Mm-hmm.
is
Mm-hmm.
is when we frame it as a problem. Just right now, Lee, if you go inside and you take on that word problem,
Mm-hmm.
does that feel light or heavy?
It feels heavy.
It feels heavy.
It feels heavy when you take on the word problem. Yeah,
Yes,
absolutely. Yeah.
yes. And when you try on that feeling, try on the word project, you might notice that that feels lighter.
Mm-hmm. Yeah. And when I hear the word project, I hear there's a lot of different words that come up for me. And one of those is creativity,
Mm,
and interest and curiosity, and maybe even a sense of peace and calmness. Because when people that have anxiety and they're having that hypervigilance and they're very anxious or nervous or scared, they can engage in something like that, right? Where if they're busy working on a project, they're distracting themselves. They're not avoiding what's going on right now. We're not doing that. There's a difference between distraction and avoidance, I think.
yes, yes.
Distraction is when you're taking whatever is making you anxious and you're saying, you know what, I'm going to put this over here for right now, but I'm going to go over here and I'm going to work on something else that's going to help keep my mind going and keep me distracted and help me get my creative juices flowing.
Right, right. So I'll throw the question back. I like this kind of back and forth. What about you and your clients? What are you noticing?
You know what? I'm noticing a lot of different things. I'm noticing opportunity, like what you were just saying, where folks can get creative with something. I like what you said about a problem and project and being able to use that. I'm also seeing on the other side of it a lot of uncertainty. There's a lot of that too, which is kind of like anticipatory, like kind of grief, right? Fearing what is the unknown, what's going to happen later on. And so
Mm,
there's a lot of that I am seeing. And so we're working on those feelings. And one of the things that I'm really recommending that I think can be pretty powerful right now is mindfulness, being in the moment. And it's taking one day at a time with it. Because, when we go into what I call future tripping, and we go down that rabbit hole, it's easy to spiral. But if we can pull ourselves back and go, well, what can I do right now? Because uncertainty, it can definitely be scary for a lot of people, and we're fearing that. We keep seeing numbers of deaths that are rising. um, this virus happened so quickly. We heard about it in China, Italy, then we saw a nursing home that had it in Washington, and now it's
right.
everywhere.
Yeah.
And so there's a lot of that. And so I'm hearing that. Um, I'm
And so
hearing, yeah, go ahead.
and so you're you're working with these individuals and couples in the face of this wave of of anxiety. And I like what you said about mindfulness, uh, because anxiety is a function of when the mind chatter over focuses on future,
Yes.
right? and
Mm-hmm.
and will I be okay? Will my family be okay? Will my finances be okay? All of this future orientation, and kind of when we pull future anticipated pain into the present moment,
Mm-hmm.
we have anxiety. um,
Mm-hmm.
so so for you, mindfulness is one way of letting go of that uh, that focus on the future,
Hmm.
being present. Um, what do you suggest to people who would benefit from letting go of that future orientation? What are the mindfulness techniques that you found to be most helpful?
One of the things that I find very helpful, and I think it's very easy to do, but I don't think that we do enough of it, is breath work. I think it's very powerful. I think it's highly needed during a time like this, but virus or no virus, it's so needed. You know, we're always on autopilot mode. I live in Washington, D.C., so everyone is like, go, 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 go all the time. And so I think sometimes when we're on that autopilot mode and we're going, we're not thinking about how do we take care of ourselves? And
Yeah.
so breath work, I always recommend 10 deep breaths a day, you know, in the morning, in the afternoon, in the evening. Doing some type of breathing can really help. It helps ground you and it can actually do a reset for you. And I
And it's
think
with
that's,
you.
and it's with you all the time. And I don't think enough people do that. And so when I work with my individuals and couples, that's one thing that I really do recommend. The other thing that I recommend is really noticing what's going on in your body.
Mm.
You know, the mind and body are so connected. So being able to feel that, I work with a lot of folks with chronic pain and chronic illness. And so I always recommend a body scan daily. So at this time, I'm recommending a body scan. You know, when people feel anxious, they have digestive issues, they get headaches, they feel tension in their body. And so being able to be attuned to your body on what feels a little odd today, where is there a little bit of a pain going on, and how to pay attention to that. And I think when folks can do that and they can take a seat back and focus on that, it can really help them focus on where they need to be in that moment.
So important, so important. I know that for me, I have a tendency to want to carry my shoulders up here.
Yes,
You
me
know,
too.
when I'm
My
tensing, and
yeah,
that body scan
yeah.
is just a way to remind myself, hey, there's no threat right here, right now.
Hmm.
I look around, I'm perfectly safe, perfectly comfortable, perfectly situated in my own kind of body, and so I can relax into that, knowing that in this moment, all indications are that things are okay.
Right. And I think that when we tense up, we get more anxious and
Yeah,
our body starts to hurt. You know, we
yeah.
may experience some pain. So being able to do some type of breathing, some type of progressive muscle relaxation is great. You know, I use that a lot with my chronic pain patients, but also with folks that are just very anxious right now, especially during this time, because I think what I'm seeing in my practice, the anxiety rates are like really up right now.
Yes.
And we're trying to decrease that so we can focus on what can we do in the moment.
Well, Dr. Lee, you said progressive muscle relaxation. Can you just talk about what that actually means?
Well, you know, what I use in it is that we look at different parts of our body. So we go from like a head to toe. So we tense things up and hold it for anywhere from like 5 to 10 seconds and we let it go. So what you were just doing with your shoulders, so we can tense up, hold it, and then breathe it out. And we can do that with each part of our body. And I do that with the body scan too, where we start at the head and we go all the way to the feet, you know. And the body scan that I use a lot of times, if I really want to go deeper, it'll take an hour to do, but
Mm, mm.
sometimes we don't always have that time, so we can do a quick body scan. And so it's taking each part of your body, including your face, tensing up your face, tensing up your arms, your legs, your hips, your buttocks, everything, and then letting that out. And I think that can help release any tenseness that's definitely going on in that moment.
Yeah, yeah.
Yeah.
I have on my website, and I'll post in the show notes, a recorded progressive muscle relaxation exercise that's on my website. Do you have any particular resources on your website that you would like to point out to viewers?
Well, I'm going to be finishing my blog today, and I'm definitely going to
Wonderful.
be posting some resources up there today. I'm going to be talking about the anticipatory grief process that is going on and how that can cause some low sexual desire, which we can definitely get into,
Yeah,
and
definitely.
what's going on sexually with folks and how you can be more in tuned into your body and to receive sexual pleasure, whether that's with your partner or with yourself during this time. And I'll have some links there that I'll be sharing for folks on my
Wonderful.
website as well. I think that's the great thing that us as therapists and sex therapists are doing at this time is really writing. We're throwing out those resources for everyone
So
to
true,
take.
so true.
Yeah.
It's particularly needed uh, uh, because we know that stress and anxiety for a lot of people can be a desire killer,
Yes.
right?
Yes. Yeah.
It,
When people get stressed, the last thing they think about is sex.
yeah, yeah.
Or some people get stressed and they want to have sex all the time.
I was just going to say, yeah, right. They're looking for release,
Yes, I
and
need the release. They're having that spontaneous desire, right? They think
right.
about it and then they want to go right into it.
Yep, exactly, exactly. And yet there's just the problem can come from if you are flying solo and you don't have a partner or partners
Mm-hmm.
to have a sexual experience with, if that's meaningful to you, or you may be with your partner or partners 24/7, and that level of constant contact can be a deterrent for
Sure, it can.
desire development.
Mm-hmm. Mm-hmm. It's going to go either way, I think. It's going to increase the desire with your partner, or it's going to say it may lower the desire because maybe you are with them all the time. Maybe you are someone who's non monogamous and you want diversity and you want novelty,
Right.
which is another factor that comes up with us. And so we're really looking for that connection. And so we're seeing more folks on the apps, maybe, but people are really trying to do this social distancing thing that's going on. And if you're someone that's on these apps and you're not listening to the whole social distancing piece that's happening, I think you need to be careful about that because if you are having hookup sex, you may have a little bit of compulsivity that's going on. And so I
Mm.
think it's trying to pay attention to that too. I'm also seeing that with some of my couples, they don't want to touch each other because one partner may be the one going out to the grocery store or going out and doing the errands, and they don't want
Mm.
to come home and get their partner sick. So what I'm trying to do is get my clients to get really creative with their sex play, right? Mutual masturbation, different touches, different things that they can engage in. The body is amazing. We can try all different types of things for sexual pleasure.
Yes. And what is the role of sexual pleasure for managing anxiety?
Well, I think the role that sexual pleasure does, when I think of sexual pleasure, I think of soothing.
Ah,
It soothes the body, the release of an orgasm. If you can have an orgasm, I work with a lot of clients where they're not able to have an orgasm. And so I always say, look at your body like a blueprint of pleasure and touch where you feel the most sensation and use that
yes,
and
yeah.
use that for pleasure. And I find that when people do that, they start to look at it differently. They're like, I can have pleasure. I can feel good. I can do different things. I think there's a lot, I know Pornhub is like skyrocketing right now, but I think that there's a lot of different things that people can do. I'm starting to see a comeback with phone sex.
That's going to be your side gig.
Yes, that's going to be my side gig while I'm doing this, because I've got my earphones in, so I'm going to just become a phone sex operator, maybe do that on the side. But
No, but I saw today, and it was a really provocative reframe. Is that we're using the language of social distancing when we're really talking about physical distancing.
we are social distancing. We're being social right now with
We're
each
being
other.
social right now, and how important and meaningful
Mm-hmm.
having these relationships with interesting people, with people we care about, sharing ideas, sharing just the having a common experience,
Yes.
right? We know that as social animals, it's in our common experience that allows us to traverse difficult times, right?
Hmm.
That when we feel alone, that really increases our cortisol level, our stress hormone, and makes the navigating difficult times so difficult. So yes, we're being social right now, and really how, as sexual health professionals, we want to encourage people to be social while maintaining physical distance, um, with those outside of your particular, home, or what's the thing I'm thinking of? Just your network of people that you have to care for, right?
Yes, and you're exactly right about that. I think one of the things that I've been seeing with my clients as well is that they're checking on people more. They're building closer connections with people. They're having virtual happy hours. They're having virtual family reunions. Pretty soon, we'll probably be seeing a wedding. I mean, people are need to be engaged. Like what you were saying, we are social animals. We crave that.
Crave
And we
it.
want that and we need that. And we need the physical touch too. And I think that's where people are struggling. They're cooped up in their homes. Of course, they're going to get horny. They want that.
Yeah, and how that can be okay. I'm
Yes.
thinking, I'm
Yeah.
thinking about, right now, I suspect, I imagine you've seen this too, um, couples who have already grown apart, and the only option that they have right now is to continue to live under one roof. And
Yes.
I'm a believer that if if we um, take for if our fundamental assumption is sex is about pleasure,
Hmm.
then and we have to be individually responsible for our own pleasure, well then having sex with an available partner as a means to experience your own pleasure is totally acceptable.
Of course it is. I mean, if you're in a home, say there's a couple and they're separated
Yeah,
and they're in the home
yeah,
and they've had a lot of communication discord that's caused them to separate, or there's been some other issues that have happened in the partnership, and they know that they're available and they start to feel that desire and that arousal come on, they may just go ahead and have sex. And it's okay that they do it. I've had couples in therapy where they're currently separated and they'll come in and they'll say, "Yeah, Dr. Lee, we had sex last night."
yeah,
Well, why did you have sex? What was going on? What were you feeling? Well, I started to have the itch for pleasure and I didn't want to masturbate. I wanted to have full blown sex.
yeah, yeah.
And then we process that. And then where do they go from there? Do they just go ahead and they go back to where they were after that? If that's what they do, that's what they do.
Yeah.
That's what's great about being a sex positive therapist. There's no shaming in it.
Amen, amen.
There's
That's
no
right.
shaming. It's like, we're living in a time right now where we're seeing more sex positivity. We're seeing more folks become monogamish in their partnerships. We're seeing people open up more. Monogamy doesn't work for everyone, but it does for some folks. I think sometimes, just in my experience as a sex therapist, is that they have to work really hard
They do.
to make it great. They got to get
Yes.
very creative, right?
They absolutely do. Absolutely do. I'm so glad you brought that up because, um, you know, the thing that monogamy does, and I totally agree with you. I think there is no gold standard for relationshiping. They each form of relationshiping has with itself a set of pros and cons, and really the decision is which set of pros and cons am I willing to live with. But
Mm-hmm.
one of those aspects of monogamy that then becomes accentuated during a time of pandemic is that it takes away competition. And what we know about competition is that increases desire. Anybody who's bought anything on eBay knows that when someone else is bidding against that thing that you want, you tend to overshoot. You tend to spend way more than what you would have otherwise, right? So we get much more invested in things that we feel like there's a competition. And when you've removed competition in the way that monogamy does, you have to somehow do something that increases high risk, high anxiety, low predictability, newness, novelty, which I clump together and call intimacy. You have to increase intimacy because closeness can come in and you're in the South, in North Carolina in particular, we have this thing called kudzu, which is this invasive vine. And I call closeness the kudzu of marriage because it comes in and it just takes over everything. And so you have in monogamy, you really do have to work harder to maintain a sense of eroticism.
Oh, I think so too. I 100% agree because we have couples that come into our offices who practice monogamy, and they're looking at how do they spice things up again. What do they do? I always tell folks, you got to get curious about your partner, and you got to get creative with your sex.
Yes.
What does your partner want? What do they feel? What are their erotic needs? How do we engage in that conversation with each other? And I think holding the space for that in sex therapy is amazing, and you can really help guide them and get them to a place where they can get creative.
Yeah.
Well,
your comment earlier about mindfulness becomes part of that openness to curiosity, right? Because if all I have is a story of the past, right, if I'm really pulling all of that past pain into the present moment, right, because I haven't been able to release my grip on it, then all I can do is see my partner through the lens of the story that my mind is repeating. And that is an obstacle to curiosity, isn't it?
It is an obstacle to curiosity because you're doing the shoulda, coulda, woulda in the past. Yeah. Where in the present moment and mindfulness, being in the present, there's room for opportunity.
Yes.
And there's room for pleasure and there's room for growth. And then when you go into the future, you start doing the what if. So I always tell folks, instead of the what if, bring it back to the what is.
What is, yeah.
What's happening right now in this moment? There's opportunity for you. What are, a lot of couples, they don't share what their fantasies are. Do you have a fantasy? Do you want to act out that fantasy out? Sometimes our fantasies are very personal.
Right, yeah.
So we may not want to, but if you can, and you can get to that place, I always encourage couples to do that.
Yeah, and just being able to talk about fantasies is liberating.
It's very liberating.
And a lot of fantasies that people have are not meant to be necessarily brought into reality. For example, a very common fantasy that people have are rape fantasies.
Yes.
But I don't know anyone who wants to be raped.
Exactly.
Right? But it is there's something erotic, exotic about that for them. And when we can just be open and courageous in sharing those fantasies, it demonstrates our a side of our own sexual energy.
Yes.
And maybe you see this too. A lot of where people get stuck is their sexual energy is stuck.
Right? They're not letting it out. And what's and it's in there. And I think as sex therapists, our goal is to help get that out, to bring up things to them. Of course, the client does the work, but I think with the guidance and the recommendations and the feedback, they can do that. They can find their sexual energy within them, get that out, and then that can lead to so many other things, right? The
Right.
creativity with their sex, doing new things during sex, right? I have couples that will come in and they're like, we've done the same position for 5 years.
Nipple, nipple, pussy.
Yeah. I love that.
Okay.
Yeah. And it's like, and then one partner's like, I want to be ravaged. I want to go doggy style. I want to get on top. But
Right.
they're so afraid to share it sometimes because they're afraid of being judged or something.
Yeah. Well,
Or,
and they have these
yeah,
internal messages, right? These
what,
internalized messages
from
where they
childhood.
stop, right? Where they, they essentially stop being on their own side.
Yes.
As we know, fetuses masturbate,
Hmm.
right? Boys and girls in utero are self-pleasuring, and so even from very in utero, we are driven towards self-pleasuring, self-soothing. I love
Yes.
that frame, and so that continues as children. Children naturally masturbate,
Hmm.
but when they are exposed to messages about things being bad, dirty, wrong, sinful, etc.,
You
that
can't do
begins.
that. You can't touch that. You're not
Yeah,
supposed to do that. Right.
right. So those are bricks in this formation of a dam that really can cut off our sexual energies.
It's so true. It's so true. And when we have folks that come in and that is so ingrained, for me as a therapist, it's so rewarding when they can shift that and they can say, I can be sexual. I can be more into my body. I can go and have a hookup and enjoy myself and release my sexual energy. I can say more things to my partner. I can share fantasies now. You really see a difference in their mental health. It's
Oof.
amazing. It's
Yeah.
like the anxiety decreases, the depression lifts, the fear is not there. Often clients will come in and say, I have to work around my fear. No, you work through that fear. What are you feeling in your body with that? And to be able to do that, it's extremely rewarding. And that's what I love about sex therapy, is being able to really get them to a place where they can get there and they can share that.
Well, just what a wonderful resource that uh, you are to your community. Because
And
I think,
same, yeah,
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 I think we're
yeah.
just, it's, there's just so many people out there who are living uh, a lesser than optimal life
Mhm.
because they've carried these wounds from their past,
Yes, and they're
right?
and they're so ingrained, and it carries with them all through adolescence into adulthood. And so, I think it's critical to find a way to heal those wounds or
Yeah,
those and to release those negative messages.
yeah,
And that may be through your own guidance and what you can do within your mind and your body, or a partner does that for you.
right,
Hmm.
right. Well, I've been flirting with this concept. There's a uh, form of therapy called radically open dialectical and behavior therapy, and it was developed as a um, an alternative to DBT, dialectical and behavior therapy,
Hmm.
because it was recognized that regular DBT is best for people who are under controlled, meaning that they are mood oriented.
Hmm.
And according to the research, people either lean over controlled or under controlled, kind of like you either lean extroverted or introverted. So these are temperaments. And I certainly lean over controlled, right? As I think most people who have graduate degrees who get doctorates probably lean over controlled.
I'm definitely that way.
Yeah. And so and of course it's on a continuum, right? You can be uh, uh, a little over controlled or a lot of over controlled,
Hmm.
and part of that over-controlled temperament is rule-oriented. We have a sense of how the world has to be, should be, must be, that if the world doesn't show up in ways that I say it should, then I get constricted inside, right? And I'm really flirting with the degree to which over-controlled temperament, how that impacts people's sexual experience. Because isn't an orgasm really just the willingness to lose control?
Gosh, yes. Absolutely.
And so
And it feels great when you do it. It feels amazing when you lose control.
It feels amazing when you lose control, when you surrender. What we're really talking about is surrender.
It's surrendering, right.
Yeah.
Mm-hmm.
It's like when you give up control, you get control.
Wow, that's very interesting. That's true, because when you give up control with an orgasm, you gain control of your body again.
You have this you reacquire, if you will, your own, what I call the divine inheritance, right?
Mm-hmm.
Which divine inheritance is this deep loving of yourself, right? Everybody, when we were young, we couldn't imagine being anybody else. We just loved being ourselves, right?
Mm-hmm.
Because we had this sense of embodiment, right? There was no difference between the mind and body. It was an integrated existence.
Yes.
But then, for some of us, we begin to live up in here.
All the time. And life has to
time.
be this way. And then you get this mindset of everything has to be my way and how I see it.
Exactly.
Yeah.
Exactly. So part of my job, I think, as a sex therapist, is to help people who lean over controlled to find ways to turn down the volume on their over controlledness, so that they are more open, more flexible, more available emotionally, right, to their own experience and to their partner, and reclaim that divine inheritance.
I agree with that. I think a lot of times, when I work with clients, they come in and they always tell me, we just want to have better sex. Okay, that's fine. We can work on that. I think that's critical. And as I start to work with them even more, I find out they're so emotionally disconnected from each other. And so I feel like I help them create or reclaim that emotional stability so they can have that emotional bonding with each other so they can have better sex. They're so disconnected sexually because they're not connected emotionally. And that's critical, and I think in our work too. And I think there's this process that we have to go through to get them there.
Yeah. So that there's more opportunity for meaning making around their relationship.
Yes.
And I think as our you may remember, people may remember from your Psych 101 class, the Maslow's hierarchy of needs, right?
Yeah.
And when we transpose relationshiping over that hierarchy of needs, what we realize is that when your basic needs are met, you want more and more meaning to come from your relationshiping. And for a lot of people, that becomes an impediment, right? That they want more meaning, and yet, again, as a metaphor, think of Mount Everest, right? So we're superimposing that hierarchy of needs over Mount Everest. Well, in order to climb Mount Everest, what happens to the quality of the air? It gets thinner. Right? And so then what happens to the level of effort you must exert? You have to exert more effort. And so if you want more meaning, from your relationships, you have to exert more effort.
And that's, and you know, it's interesting because I can always tell when couples are doing that and when they're not. You know, sometimes they come in and, you know, I asked him, I'm like, did you do the assignment that I asked you to do to work on? No, we had the kids had to do this, and then I had to go here, and he had to work later, and then we were too tired. You're not putting in the effort.
You're not putting in the effort.
But then I have couples that come in and they're like, oh my gosh, I learned so much about my partner. We started rebuilding our love map with each other. You know, we're starting to know each other again. I found out something about my partner that I didn't even know. And we've been together for like over 10 years. They're making the effort. That's amazing when that happens. When they do the work. I think that's one of the most rewarding things as a psychotherapist and a sex therapist, when clients are doing the work and you see it. That's when I really do give myself a pat on the back.
Right. It's the framing of therapy for me changed when I began to explain to clients it's like physical therapy. If you just did the exercises when you saw your PT, you're not going to really improve all that much. You have to do the exercises between sessions.
Right.
That's where therapy happens, is between sessions.
It's between the sessions. It's not during it. There's a lot that we can process, but the work is done in between the sessions.
Right.
I always tell clients, you know, I can cram coping skills down your throat all day, but if you don't go out and do the work, how are you going to benefit from them? I can give you suggestions, but if you don't do it, then where are we at in the process?
And that comes back to that idea of, are you on your own side?
Yes.
Right? Are you on your own side? Are you showing up in ways that show the world that I'm important to me? Which is different than narcissism. I know that's a term that people are throwing around left and right, but it's, you know, it's the putting your mask on first, right? It's how am I showing up? Am I taking care of me so that I can be more available to those people who are important?
Yeah, I think we have to ask that. How do we show up? How do we do that?
Yeah, and how is my not showing up? What is my not showing up communicating to my partner?
Oh my gosh, yes. What is that saying?
What is that saying? And what is it, you know, quite honestly, I'm one of those people who absolutely and unapologetically say that therapy, my delivering of therapy changes me as a therapist too.
Oh yeah.
Right? So there's this change process that's co-occurring, and so I want my time with my clients to be a good time too.
Oh yeah, sure. I mean,
Right?
I learned so much from my clients too. It's an amazing working relationship. It really is, and an intimate relationship.
Yeah.
You know, and a rewarding relationship, and it's healing. You know, I think this is one profession where you leave it at the end of the day and you feel grateful for what you did and for who you are.
Right.
And if you're not feeling that way, then you have to think about what's going on within you too. We have to do our own work as therapists.
We do, and kind of speaking. Let's talk about that if that's okay.
Yeah.
What are your suggestions for how someone might find a therapist?
Well, there's a lot of different ways that you can find a therapist. You know, Psychology Today is great. That is one website, psychologytoday.com. You can go and put in your zip code, and a ton of therapists come up. They really reach out to the public, you know, and they've got their picture and what they specialize in. If they take insurance, if they don't take insurance, you can ask other friends in your community. Google, of course, answers everything these days. You know, you can Google. You know, if you're looking for a sex therapist, you can always go to the AASECT website. the American Association of Sexuality Educators, Counselors, and Therapists. I feel like I always lose my breath when I say that because it's so long.
And we'll include the link down below
Well,
too.
yeah, you can go there, and on the map, you can put in where you live, and different sex therapists will show up in that area and what they specialize in. So if you're looking for someone who specializes in LGBTQ issues of concern or non-monogamy and polyamory, BDSM and kink, you can find that. So I like that AASECT really does provide that.
Is
So
that a guarantee? Earlier you used the term sex positive sex therapist.
Right.
And so, perhaps you can share with our viewers what that means.
Sure.
And how can they know when they found someone who's a sex positive sex therapist?
I would hope that sex therapists who are sex positive would include that in their bios on their website and define what sex positivity means. And really, for me, that means having the type of sex that brings healing and joy and whatever you make of that, as long as it is consensual and it's not harming you or someone else. That's sex positivity to me, and what that really means. And I think it's important to have that so the client can say, wow, this is someone that I think that I can be comfortable with, that I can work with, because unfortunately, there are therapists out there who are not sex positive, right? And they may go into a session and say something, and the therapist may say, I don't know what that means, or I don't work with that type of population, so let me refer you to someone who does. So I think it's very important to include that in your credentials when a client is looking for a therapist.
Yeah. And this is not a slight against other mental health professionals, but there are a lot of mental health professionals who are just uncomfortable talking about sex and sexuality.
Absolutely. Yeah.
And I would say that there are expertise that are available to sex therapists because of our postgraduate training that allow us to care for people with specific presenting problems that most wouldn't have gotten training in their regular graduate programs. And so that therapists who refer to sex therapists deserve their kudos too.
Absolutely.
That's just sure. I think a good indicator of competence, right? Is that one can recognize when a referral is appropriate.
Yes, and that's in code of ethics, and to be able to go by those code of ethics, that's in your, whether it's the counseling code of ethics or social work or psychology, and to go by that and to tell the client, this is not the area that I specialize in. Let me refer you to someone who can help you. And that's really what you have to do. So I always love it when I get a referral from a therapist that says, hey, I have a client that wants to explore kink and polyamory, or they have erectile dysfunction and they need to work on that, and it's causing a lot of distress in their life. And so being able to do that is really critical. I never took a sex class in grad school. There was no human sexuality course in my MSW program. And there was no couples counseling course. They kind of tied it in with social work with families in my MSW program, but there was nothing about sex. So I had to go back and do all these trainings to become, an AASECT certified sex therapist, so I can become competent to help those who are having sexual health issues of concern. So it's nice that we have something where people can do that. There are more human sexuality degrees out there now, PhDs in sexology that you can look at, but it is nice that we do have AASECT, and we have just a group of therapists who really do specialize in sex therapy.
So it sounds like the real takeaway is that if desire is a problem for you and or for your relationship, that there's really help. There's help available. Whether it be noticing your own mind chatter, being mindful, doing progressive muscle relaxation, and or working with the therapist to look at what are the impediments, what have been the impediments to desire, and to discover what needs to be present
Yes.
in order to have desire. Peggy Kleinplatz, I think, if I'm pronouncing her name
Yeah.
right,
Yeah.
she is a well-regarded sex therapist in her field, and I love her frame. So many people have this sense of there must be something broken about me or my partner if their desire isn't to my expectation. So if my desire isn't to my expectation, I must be broken. Or if my partner's desire isn't to my expectation, they must be broken.
Right.
And that framing of, again, a problem really makes it an adversarial relationship.
It does.
Versus, rather than it being what's broken, for a lot of people, the question is better asked, what's missing?
What is missing?
Yeah.
Yeah, and you can look at it like a journey that you can take together. Something's missing in our sex life. Let's find it together, right?
Yes.
Or if you're an individual and you're going through it and you want to find a partner, but you have low sexual desire, find that within yourself. I always tell people that, and it's important to look at what's possible instead of what once was once achievable. Sex is not about
one more time. Say that one more time. That needs to be said again.
It's important to look at what's possible instead of what was once achievable.
Yes.
Right? Because everyone goes into the idea that sex has to be a performance. I have to have an orgasm. If I don't please you, you're going to criticize me. You're not going to want to have sex with me. You may cheat on me. And that's not the case. Sex is about pleasure. It's about what you want and what feels good to you, because what feels good to me may feel different for somebody else.
Right.
And to be able to share that and talk about that, that's what people don't understand. And I think as sex therapists, that is critical for us to be able to work with people to where they can get into a place where they can do that. Sex therapy was always deep rooted in cognitive behavioral therapy framework, which it still is. And I think CBT works great. But I feel like sometimes as a sex therapist now, and someone who has been doing this for 2 years now, I find myself going deeper. I'm looking at more attachments. I'm doing a lot more, looking at more at imago relationship therapy and looking at Gottman methods and different things of that nature to really pull some things out. And I think that it really does go back to childhood, a lot of what's happened with negative messages that you receive about sex, right? And then you grow up, like what we were talking about earlier, and it's like, I can't do that. Well, yes, you can. And let's get you to a place where you can, and you can feel comfortable in your body to do it. I think that's what sex therapy is all about. When one thing doesn't work, we try something different. It's not about changing who you are. It's looking at things through a different lens.
Exactly.
That's what therapy is to me.
Yes.
Yeah.
Well, Dr. Lee Phillips, how can someone find you if they want to learn more about you and the services that you provide?
Sure. You can go to my website, which is www.drleephillips.com. You can also follow me on Facebook or Instagram, and that's at Dr. Lee Phillips.
Wonderful. Well, it was so great to have this time with you, and I continue to look forward to many more.
Same here. It was good joining you.